Hello friends, welcome to my channel. I know it is too late for the topic, so I'm very sorry to all the viewers who have requested for this topic. Today we will discuss about various types of oxygen delivery system. We will discuss very basic but important things that I feel this should be known by each and every medico or paramedicos. So without wasting much time, let us begin. To start, we will see something about the chemistry of oxygen. Oxygen is the 8th element in the periodic table and present at the 16th column and second row of the table. Nucleus of the oxygen atom contains 8 neutrons and 8 protons. There are 8 electrons around the nucleus. Out of them, 2 are in the inner shell and 6 are in the outer shell. The human body has around 1000 billion cells, even more than the stars in our galaxy. All of them need oxygen to carry out their functions properly. So oxygen is life-giving, life-sustaining element. Almost 90% of body's energy is created by the oxygen only. We would survive only for few minutes without oxygen. So we can see here how much the oxygen is important for our lives. Now we will see how we can supply this oxygen to the needy persons and save their lives. There are various types of oxygen delivery systems. Each of them have their unique importance. But it is important to know which one to use at which time. So let us see one by one. First of all, low flow nasal cannula. It can provide maximum FiO2 up to 24 to 28% and flow rate of 2 to 6 liters per minute. It is very cheap and easily available everywhere. Patient can speak, eat or drink with it. There is no chance of claustrophobia or rebreathing with use of it. But sometimes it can cause nasal mucosal drying and irritation, especially when used with the higher flows like more than 4 liters per minute. It is ideal for long-term oxygen therapy. It can be better used and tolerated by the home-based patients. Second is simple face mask. It can provide FiO2 of 60 to 80% and flow rate of 6 to 8 liters per minute. It is also very cheap and easily available. Actually, it is good for those who are mouth breathers or having blockage in their nasal passage. It can cause irritation in skin or eyes, and it must be removed to drink or eat anything. There is also chances of rebreathing, specifically used with the lower flow rates like less than 5 liters per minute. It can be used for home or for the hospitalized patients. Just proper fitting of the mask is necessary to achieve the perfect delivery of oxygen. Next is Venturi mask. It is available in color coded system for precise oxygen delivery in manner of FiO2 and flow rates. We can see here the specific numbers for the specific color. These colors are green, red, orange, yellow, white, blue in the decreasing trend of FiO2 and flow rate. It can provide the most reliable and most accurate delivery of fixed FiO2. It is a well-controlled oxygen delivery system. Like the simple mask, it can also cause irritation in skin or eyes, and it must be removed to drink or eat anything. It is mostly used with hospitalized patients with higher oxygen demands. It ensures the flow rate very precisely as per the protocol. Mostly low delivery mask like white or blue color is suited for the COPD patients who have chances for CO2 retention. Now next one is NRBM, non-rebreathing mask or mask with the reservoir bag. It can provide 80 to 100% of FiO2 with 10 to 15 liters per minute of flow rate. It can meet higher oxygen demands. It is also a kind of mask only, so it can cause irritation in skin and eyes. And it must be removed for drink or eat anything. It is mostly used with hospitalized patients only with higher oxygen demands. To ensure the proper oxygen delivery with this mask, proper fitting of the mask is necessary. Reservoir bag should be inflated all the times, and one should avoid removing mask frequently. Repeated assessment to be done for the desired outcome. Next is high flow nasal cannula. It can provide 95 to 100% of FiO2 and 15 to 60 liters per minute of very higher flow rate. It provides reliable delivery of oxygen and meets the higher oxygen demands. Patient can speak, eat or drink with it. There is no chances of claustrophobia with it. But most of the times it causes nasal mucosal drying and irritation as it uses very high flow of oxygen. And there are some tolerance and compliance issues also with this. It is mostly used in hypoxic respiratory failure. Repeated assessment and titration is very necessary. It can substitute NIV in some patients who are having tolerance issues with the BiPAP mask. So all these are simple oxygen delivery systems where we provide oxygen at different flow rates and different FiO2s. But other all things like tidal volume, airway pressure, respiratory rate and expiratory pressure can be completely manipulated by mechanical ventilation only. So we can say them as artificial lungs. This can be of two types, invasive and non-invasive, where we can completely take over the lung function when required. Actually, this can be a separate topic for the discussion. So that's all for today's talk. I hope you all understand well. Thank you so much. We pray for the good health of all of you. Please do share, like or comment on the video and subscribe to our channel. Till then, goodbye, think less, do more and always be happy for being healthy.